Fertility preservation was first tried and used and perfected in the field of species that are at risk of going extinct. So it was a method that was used to try to preserve different kinds of species. Then it moved into the patient population of adult cancer patients, where the therapy treatment they needed for their cancer treatment could negatively impact or harm or destroy their fertility. And then in the early 2000s, it actually moved into the pediatric cancer patient population, so that children who also, are afflicted with cancer might have the ability to someday grow up and have a biologically related child. But now we've seen it expand into the scope of gender affirmation care as something that's offered. We have to be mindful that maybe we don't want to offer this to children. I was a former pediatric critical care nurse, but for the last 20 years, I've been spending most of my energy in the whole area of fertility, infertility, and assisted reproductive technologies. I was deeply concerned as a nurse, as a filmmaker, when I learned that children who, before their puberty was blocked or before they were put on cross-sex hormones or offered surgeries, were offered fertility preservation as part of their care. And again, knowing that, the younger the child is, they're going to be offered cryopreservation of ovarian or testicular tissue in stage 2 to 3 Tanner stages where they have not yet developed mature gametes. It's one thing to provide the possibility of having a biological child for a cancer patient, adult or pediatric, who needs a treatment to potentially save their life. But it's a whole nother thing to offer a person who has healthy fertility, who we knowingly are going to damage, but we're going to offer them fertility preservation as part of their care. The research that Dr. Lahl cited on one of his slides that we published in March of 2025 in Frontiers in Endocrinology, titled "Fertility Preservation, Is There a Model for Gender Dysphoric Youth?" We found only 2 reported live births in the pediatric female patient where ovarian tissue cryopreservation was done. Only 2 of those young women that were aged 9 and 13 at the time of having their tissue frozen were able to successfully have a live birth. And one other case was reported in a 14-year-old female. It did not say whether or not she had been through puberty or not, but this young girl was able to, after 4 rounds of IVF, was able to finally give birth, have a live birth, but she did deliver prematurely. But in each of these 3 cases, all of these patients had to have a gonadotoxic therapy to treat their cancers. In the male population, we found 0 reported success cases of young men that were offered the freezing of their testicular tissue. Embryo freezing, actually, in the CDC data, shows the highest success in live birth. It's the freezing of embryos, and we know in the gender youth population, they're not freezing embryos because they're not partnered with anybody yet. They just are freezing their own egg or their own sperm.